are talking 5 tips for those of you planning a natural labor and birth. I am doula Terry. I've been a birth doula in New York City for more than 20 years now. I have tips on pregnancy and birth. Today I'm defining natural birth as unmedicated. Some people would call just any vaginal birth natural, which fine, any birth to me is natural. We're talking unmedicated today. 5 tips. We're starting number 1. I really encourage you to take a class, you and your partner to take a class. If you can do them in person, great. There's lots of wonderful on-demand classes as well. I have one, lots of my colleagues have them. Find a good class, take that. Part 2 though, don't get so caught up in what you're learning that you forget to bring yourself to your birth. The tools you have used to cope in your amazing life thus far are going to serve you very well in labor. How do you quiet your mind? How do you comfort yourself? How do you handle stress or pain? You know these things. You have worked with them before in your life. Bring that to your birth. Number 3, it's very important that if you have the option of finding a place to birth and to birth with a care provider that's going to be supportive, it's important you seek that out. What I would prefer for you to not have, again, if you have the choice, is to be in an environment where you're swimming upstream, where everybody else is getting all kinds of interventions and you're there trying to do it differently. So if you can support yourself by being in an environment and with a care provider that really gets you and gets your goals and can support your goals, that's a huge, huge boost. Number 4, who are you bringing? If your intimate partner that is coming to the birth is not somebody who's really confident in that advocacy role, in that protecting the space around you, in that speaking up role, then who else could you bring? Could you bring a doula? Could you bring a friend or family member who's just kind of good at that stuff or comfortable in a hospital environment if that's where you're birthing? Because you should not be wearing 2 hats when you're in labor. If you are laboring and birthing, that's all you need to be doing. You can't be thinking about, hey, I'm also supposed to be advocating in this and asking for that. Number 5 is just to remember your 3 questions. Am I okay? Is the baby okay? May we have more time? It is always useful in a busy labor and delivery environment to ask for more time, especially if it's your first or for whatever reason your labor is taking time. If everyone's okay, let it be. Give your body time to figure it out. You got this.